Hello students, and welcome to your discussion forum feedback. So this week we were discussing the topic of insurances paying for infertility services. As you already understand and have knowledge of, that insurance companies are very picky of what they reimburse and what they don't. And infertility services are basically covered by the patient's actual own out-of-pocket expenses. Unless the patient has some type of disease or disorder related issue, the fertility services may or may not accept insurance coverage. But even then, if the patient's insurance coverage does not reimburse for infertility services, the patient has to pay for out-of-pocket. So the best way to help a patient, or to even help the facility that you're working with, doesn't matter what position you are performing. If you're a medical coder, if you are a medical assistant, if you are a doctor, if you are a scheduler, the first approach that you would want to take is to contact the insurance company yourself with the number on the back of the card and begin to speak to representatives as you are transferred along until you find the right department, and explain what you're needing. You're needing to know if the patient's coverage has infertility services reimbursement, and if so, what do we have to do to ensure that the patient is receiving reimbursement on their insurance coverage. So with that being said, you would have to, again, look for the phone number on the back of the insurance card, and then go ahead and call the phone number and begin to ask questions on the type of coverage the patient has. When it's time to explain to the patient that they may or may not have insurance coverage for infertility services, you would go ahead and follow protocol of how your facility would like to communicate that information. So, thank you very much for your engagement in the discussion forum. Please continue to respond to 2 or more classmates with information and ideas and explanation on why you think your classmate has an awesome sauce post. So, for example, you would like to say, I think that your post was so great because it actually outlined the steps that I would have to take to ensure if the patient has infertility reimbursement services or not. So again, you want to engage in discussion to ensure each student is mastering their course content. So until next time, Instructor Pamela here. Continue to journey well. Bye-bye.